Retsef Levi is the J. Spencer Standish Professor of Management and Professor of Operations Management at the Sloan School of Management at MIT. At the SIAM Conference on Optimization last month, he gave a talk on optimizing and coordinating healthcare networks and markets, which surveyed healthcare network optimization problems that are typically challenging in practice and theory. Retsef, thanks again for joining us. And I wanted to first start off by asking a broad general question about your work. How does optimization make an impact in the area of healthcare management, infrastructure, and costs? Could you try and explain that in layman's terms, if possible?
Yeah, I think that if you think about most of the decisions that organizations that have to deliver care or manage health of patients, if you consider all the important decisions that they have to make with respect to how to deliver appropriate or high quality outcomes, clinical outcomes to their patients, as well as how to best use their resources, they essentially have to make very difficult trade-offs of how to use scarce resources and make priorities of where to use these resources with respect to what patients to use them. And this is typically something that optimization, both in terms of modeling, namely how do you take those very complex decisions and model them in a way that allows you to think very carefully and very rigorously about these trade-offs, as well as algorithmically, namely, once you have a model, how do you translate and leverage this model into a decision support tool that really can recommend how these trade-offs can be managed in the best way. It's a very natural fit, and this is why I think that these models and these approaches are so potentially impactful on this industry, particularly because this industry, maybe unlike other industries, has not been using these approaches in as much as one would wish. If you compare the healthcare industry to the airline industry, it's fair to say that almost every airline company in the world, or at least if you take one of the major airlines companies in the world, is using optimization on a regular basis to make both strategic decisions as well as operational day-to-day decisions. And that's not the case currently in most healthcare organizations. And this is why I think the potential is so huge.
Do you know why that is? Why has the healthcare industry been slow at adopting these types of techniques?
Yeah, I think there are several reasons for that. One of them is the cultural evolution of this profession, of the medical profession. I think the medical profession has evolved as a very individualistic art kind of profession where essentially individual doctors are making ad hoc decisions for every patient and essentially practicing an art. And throughout the years, people realize that as romantic as this might sound, that's not the best way to either provide the best care to patients or to provide the most cost-effective care to patients. And this industry has been transitioning to realize more and more that this is something essential that they really need to use. The other challenge was the availability of data. I think that many healthcare organizations until several years ago, and even now, just don't have even very basic data that will allow them to build these models effectively and then use them in an appropriate way. And finally, I think that the pressure for those organizations to make thoughtful trade-offs did not exist for many years and has been increasingly become a major consideration for them over the last 5 to 10 years. So I think we see a very strong external pressure as well as a very strong internal trend among healthcare professionals, healthcare delivery systems and leaders within those systems that realize that unless they change in a very fundamental way the way they think about their business and incorporate much more rigorous and data-driven approaches, they will not be able to sustain and or, fulfill their mission. There is still one difference between these organizations and maybe other industries where, to a large degree, this is not only about making money. It has to be centered first and most of all around patient care and how you optimize patient care. And to some extent, that kind of give rise to some uniqueness that I think can still be addressed by those models, but one must acknowledge that this is not just a plug and play translation or import of tools that were used in other industries to this industry. There are some special attributes and special characteristics that we have to acknowledge and really adapt these methodologies to really capture the unique trade-offs that the healthcare industry is facing.
Right, right. I guess it's not like the airline industry where the main focus is profit and improving your product. I guess that's
Well, as someone that flies a lot, it's definitely not providing good experience to customers. So many of those, many of those airlines.
That is true. I've definitely been very uncomfortable on flights myself, so I relate to that. Can you speak to the importance of design and performance analysis of optimization models in this field, particularly, like perhaps by giving a specific example of an optimization problem in healthcare?
Yeah, so I think that usually when those of us that studied the optimization in university and got like either undergraduate degrees or even graduate degrees, we typically think about optimization models as something that gets some input and gives you a unique optimal solution. But the real use of optimization models within practical settings, and in particular in healthcare, is actually not necessarily to give you one single solution, but in fact to give you a robust framework to actually consider different trade-offs of different Pareto solutions that each maybe trades different considerations in a slightly different way, and allows decision makers not only to think about those problems more rigorously, but actually anticipate what would be the impact of certain choices that they could make. So when I use the term optimization model within the context of the healthcare industry, I really think about the latter framework, which is something much more robust that really is facilitating a discussion on trade-offs. And in healthcare, almost every choice that you're going to make is going to have some trade-offs. So, for example, if you think about a typical academic medical center, I'm working with several of the largest academic medical centers in the Boston area. But if you think about a place like that, we usually think about those places as a place that clinical care is being delivered to patients. But actually, these places are far more than that. They in fact are schools in which residents are being trained, so they have an educational mission. They are also research labs in which new clinical treatments and new devices are being developed, and the doctors and the other staff that are working in these entities are doing far more than just caring for patients. Some of them are teachers, some of them are researchers. So when you want to optimize the system, you have to really carefully ask yourself, you optimize for what? Let me just give an example. I can decide that from the perspective of pure efficiency, if I want to use my operating rooms in the best way, I should centralize the control on them and essentially give each surgeon time to perform his or her surgeries only when they need it, right? But that would lead to a system in which each surgeon 1 week has to operate on Wednesday, and another week has to operate on Monday, and maybe another week has to operate on Tuesday. And this is not going to ever work in a place like academic medical center, because they must be in class in some days, and they have clinic times, and they have labs that they have to operate. And if you try to mess with their schedule every week and get them to operate in a different day, then you're guaranteed one outcome. They are not going to work with you and won't even want to listen to your optimization model. So that's one type of a trade-off. The other type of a trade-off is really something that comes from the fact that as much as we want to put infinite resources into healthcare, the unfortunate reality is that resources are scarce, and sometimes you have to make tough choices. So, for example, when you think about the list of people waiting for kidney transplant, one trade-off that sometimes you face is that you have a kidney and it can match maybe several people in different levels. Some of them are maybe more severely ill, but those could be also ones that if you give them the kidney, they will live just a couple of few years.
Right.
While others that are maybe in a healthier state, if they get the kidney, they might actually live many, many years. So how do you think about this fairness? What does it mean to be fair here? This is very difficult modeling questions, and that has to do with a lot of choices. But the problem is that if you don't create an optimization model to think about those kind of questions and those kind of trade-offs, you're going to end up in a very emotional and anecdotal discussion rather than to really deeply understand what each choice of fairness, of notion of fairness, could actually imply in terms of how well are you going to use the overall kidneys that you have to transplant, right? Now, a third example is if I'm a healthcare delivery network and I really need to make decisions of where to do different types of surgeries, where maybe I have a central location in downtown, which is the primary academic medical center, but I also have maybe some community hospitals more in the more kind of distant from the urban center. And I need to decide where to put different procedures. Now, it could be that from an efficiency and a scaling perspective, I want to concentrate a certain set of procedures only in one location because that will allow me to specialize, that will allow me maybe to have some economies of scale. But I also have to consider patient access, and not all patients can or are willing to travel maybe the entire distance from where they live to this one location. So these are very delicate choices, and there is no black and white answer. You can actually think about different choices that you could make, and the optimization models that one can develop, especially if they are based on data, can really allow you to consider the Pareto optimal solutions. What do I mean by that? It is a solution that if you want to improve it in one dimension, it probably means that you have to really make a choice with respect to other dimensions. So you cannot just improve all dimensions at the same time. You definitely want to have a solution like that. So because if you don't have a solution like that, then you're leaving some money on the table in the sense that you can actually do maybe better in all dimensions, right?
Right.
So this is I think maybe a slightly less traditional way to think about optimization in the context of many practical settings, but in healthcare, I think that the trade-offs are very, very kind of sharp and difficult to decide because sometimes they also involve some moral choices, right? So, and that's kind of these are usually very tough calls.
Right. And so you have described like a series of different challenges that you do have with optimization of healthcare in the real world, like, taking into account the convenience of doctors, of patients, and access basically to healthcare. But what is the solution to these challenges from an optimization perspective? How do you, I know you talked a lot about that in your talk, like the challenges to optimization models. How do you provide a near optimal policies for these difficult models that are conceptually impractical?
So I think that the main thing we provide is the ability to describe to decision makers the Pareto optimal set of solutions, in the sense that we help them identify what are the major trade-offs that they have to think about, what kind of choices they can make, and what is the curve of Pareto optimal solutions that they could choose from. Right. And that's where the major impact is. And it really has to be incorporated into the overall decision-making process within the organization, because otherwise, if you think that you can build some a black box standalone optimization tool and hope that this is going to really convince people to listen to the oracle, right? To the oracle, it's not going to happen. It's not going to work.
Right, right.
These are very culturally conservative industries. Every decision has the potential to impact not only the quality of life of the employees, but actually the life of patients. Needless to say that it could have some serious financial implications. So it's really about enabling a robust discussion around where on the Pareto optimal care view one wants to be. And also modeling and also allow people to see and model the very complex dynamics that these networks, these complex systems usually have, in the sense that the last thing that these networks are one entity that is centrally managed. If you think that the CEO of the hospital is managing centrally the entire hospital, that's probably wrong for most hospitals. If you think about academic medical centers, for example, in fact, there are actually 2 or 3 entities that play a role in managing the place. There is the hospital, which is usually managed by the CEO of the hospital. There is the physician organizations that has its own leadership and works usually together with the hospital. And then a lot of the time in academic medical centers, there is the university, there is the academic and educational side that usually the dean of the medical school represents. And in different systems across the US, for example, the relationship and the way these 3 entities are set up together could be very, very different. In some places, they could all be integrated under one entity. In some other places, like many of the Boston area academic medical centers, they could be completely separated. So whatever you create, whatever model you create, you really have to understand what kind of dynamics the environment has and really incorporate this into the model. And that also is another aspect that makes these models far more challenging maybe than some other settings in which you can assume that a centralized entity is controlling everything.
Right. Okay. So it's basically looking at the way the scenario would play out in the real world and allowing them to make a decision based on
and
the model.
understand the choices, understand the impact of their choices, and
Right.
where do they want to be on the Pareto optimal curve.
Right. Right. And I think this is kind of a relevant question just because of the time. With the rapidly changing healthcare scene in the US, especially now with the Affordable Care Act, how important a role do you think such optimization models will play in managing and providing access to quality healthcare?
Well, I think that there is more and more evidence that this could play a major role. There are more and more organizations that are in the healthcare industry that become more and more open and actually seek proactively to get input from people that know how to create optimization models from tools that allow people and organizations to use those approaches. And I think that academics also realize that this is a huge opportunity. So I'm very optimistic that not only that there is already a proven impact, and we mostly talked so far on the, let's say, operational and resource allocation type of decisions, but in fact, optimization currently plays a role also on actually designing clinical treatments. For example, there are many places in the country today that cancer radiation is being designed using very sophisticated optimization tools to decide how many rays of radiation and what angle and what power each ray should have in order to maximize radiation on the cancerous tissue and minimize radiation on the non-cancerous or very critical organs in the human body, in the patient body. So I think that the potential impact is proven. I anticipate that this is going to expand both in terms of the scope and in terms of the scale. And I hope and believe that this is going to play or could play a major role in enabling essentially the vision of the Healthcare Act to be fulfilled. Because if you actually think about the healthcare reform, it's mostly a statement of intentions, but there is a lot to do with how to actually implement it. And
Right.
this is where I think optimization is going to play a major role, optimization models and optimization approaches. Now, the last thing that plays a very major role in catalyzing this trend is the fact that more and more systems are actually being forced to have very sophisticated IT systems that will allow us to have the data that is so essential for the ability to actually create and use those models effectively.
Right, right. So yeah, that will be really good to see because any system requires some kind of testing and optimization to figure out how it works, but especially something as ambitious as the Affordable Care Act, hopefully will incorporate a lot of this thinking so that the decision making is done with a lot of information at hand. One final question. What motivated you to study these types of optimization problems? I know you study optimization in various fields and not just in the context of healthcare, but was there anything that motivated you to study this?
Well, I mean, I think that healthcare really poses a national challenge and a global, worldwide challenge. And I think it's a place where you really can make a huge impact. But the other thing that kind of maybe intrigued me, and I was about to mention this before, is that it's really the challenge of taking optimization approaches and incorporate them into an overall organizational decision-making process, taking into account a much broader set of considerations than just the analytics per se, but actually thinking about the culture of the organization, the culture of patients, the behavioral sides of this. The effort to actually leverage the optimization part into real impact really goes through all of these aspects. And to me, as an operations research person, that's the essence of operations research, which is to have one leg in the analytics and the data, but another leg in the deep understanding of what this organization is about culturally, structurally. How do they make decisions, and how do you match and marry all of this into something that really ultimately affects positively decisions that are being made, both strategically as well as day to day.
Right. And that's a really good way to put it, to actually understand the culture of the system also and look at it as how it works in real time. Thanks a lot, Retsef, for your time today. And viewers, you can listen to and watch Dr. Levy's presentation from the Optimization Conference on our website at siam.org/meetings/presents.php and select 2014 Conference on Optimization to view all the invited sessions from that meeting. Thank you.